right, everybody. This video is bones of the spine and thorax. So we are going to get started and go right into the screen share. We are on page 170, 171, 172 in your book. And this is officially chapter 3. Or I'm sorry, chapter 4. Chapter 4. Although everything's color coded, so I guess this is really, I don't think they have them listed like that. No, it's chapter 4. Okay. It doesn't really matter. Okay. Page 170. All right, so what we're looking at here, of course, is the spine and the thorax. And the thorax, of course, is this area from just below the cervical spine to this area just above the lumbar spine. So we're going to begin talking about the spine, and we're also going to talk a little bit about the ribs and rib cage and things like that. So we actually have 24 vertebrae. We have 7 cervical, 12 thoracic, and 5 lumbar. The sacrum and coccyx down here do not count as vertebrae, though they are part of the spine. We already know the sacrum because we palpated it before, and the coccyx we know is about 3 fused vertebrae that hangs off of the inferior portion of the sacrum. So when we are talking about the spine, we're talking about it in terms of its location and its number. So this vertebrae right here would be C1 for cervical vertebrae number 1. This one would be C2 for cervical vertebrae number 2. It's just easier to say C2 than cervical vertebrae number 2 or whatever. This one right here would be thoracic vertebrae number 1, so it's T1. This one down here would be lumbar vertebrae number 1, so it's L1. Okay, it's just easier to give it a letter and a number rather than say the whole thing all the time. The first 2 cervical vertebrae actually have special names. C1 is called the atlas. C2 is the axis, and we will go into more detail when in a couple minutes when we talk about those on that page. For now, we're just kind of getting an overview. So if we move down into the thoracic area, this is where the ribs articulate, and they actually articulate more on the anterolateral portion of the vertebrae, so they don't articulate in the back necessarily. You have spinous processes and transverse processes, and the ribs are anterior to those. So that's how everything's set up. And of course, you have the clavicle and the scapula, which don't really articulate with the ribs. Remember, there's a space there, and it's filled in with a couple of different muscles. If we turn the spine around, it looks very, very different, right? In fact, so different that it's hard to tell what things are at first. So these are what the ribs, or I'm sorry, these are what the spine and vertebrae look like on the anterior. You have a couple of different structures here. First of all, you can see the bodies of the vertebrae really nicely. Blow that up for you. There's not a whole lot of landmarks here. We can see the transverse processes here and here, but we also see something that we can't see from the posterior view, and that is the intervertebral discs. They're in between the vertebrae, so they're intervertebral. These discs act as spacers between the vertebrae and shock absorbers because, you know, we're upright. So it's nice to be able to not crack our bones every time we jump or run or anything like that. So they do act as shock absorbers and, like I said, spacers. And the spacing is really for the nerves that exit the spinal cord on either side of the vertebrae. All right, so let's make this a little smaller. So on the anterior, you can see all the ribs. The ribs articulate with the sternum. And the sternum actually has three parts here. There's the manubrium, which is this part up here that articulates with the clavicles. There is the body of the sternum, which is the hard part in the front. And then just at the inferior angle here, we have a landmark called the xiphoid process. It's spelled with an X, but it is the xiphoid. It's pronounced as Z, xiphoid process. And this is the little, let's say, dangly bit off of the end of the sternum. This is going to be an attachment site for abdominal muscles. And we'll talk about that later in this unit. So we have all these lovely ribs here. And you notice that they don't attach directly to the sternum bone to bone. They attach to cartilage and then to bone. Cartilage and then to bone. So we have a couple of different joints here. Now these joints are not freely movable, so they're going to be considered synarthroses, or not articulated, not moving. Okay. Move that over for a second. So here, I lost my pointer. So here we have, there it is. Right here where the bone, the rib itself, meets the cartilage is the costochondral joint. Costo refers to ribs, chondro refers to cartilage. We did have chonder way back at the beginning with our med terms. Chonder refers to cartilage. So a costochondral joint is one between the rib and the cartilage. So there's one right there. Now, where the cartilage meets the sternum is the sternocostal joint. So it's talking about the rib as a whole. Where it meets the sternum, sternocostal joint. Okay. Now within the ribs, not all ribs are created equal. We have true ribs and we have false ribs. True ribs are ribs 1 through 7. So 1, 2, 3, 4, 5, 6, 7. Those are considered true ribs because they attach directly to the sternum with their own piece of cartilage. Okay. These are easier to understand. 7's a little harder to understand, but either way, they attach to the cartilage, or they attach to the sternum with their own piece of cartilage. So they're considered true ribs. Ribs 8, 9, 10, 11, and 12, which are difficult to see here. You can see some of them. Either attached to the sternum with a shared piece of cartilage or do not attach to the sternum at all. And those are called false ribs. So ribs 8, 9, and 10 here, there's 8, 9, and 10, they share a piece of cartilage that attaches to the sternum. Ribs 11 and 12, which are difficult to see, this one right here is 11, and this one right here is 12. They don't attach to the sternum at all, therefore they are floating ribs. And like I said, ribs 8, 9, 10, 11, and 12 are called false ribs. So we have true ribs and we have false ribs. And just as a side note, this is a really lovely view of the sacroiliac joint. You can see how the ilium fits flush with the sacrum on both sides. It's just a lovely picture of the joint there. All right, we're going to move on to the vertebrae. Actually, I'm going to skip ahead for just 1 second. I'll come back to the vertebrae. Since we're talking about the ribs, let's continue talking about the ribs. Page 173. There we go. Page 173. So we were just talking about these ribs. True ribs are ribs 1 through 7. You can see false ribs 8 through 12. And there's a lovely view of the floating ribs. Okay. The floating ribs are 11 and 12. So you can see that they terminate right here and right here. They do not attach to the sternum. Now, the 12th rib is going to be an endangerment area for us massage therapists because it does hang out around some low back muscles. We can palpate the edge of it though, so we should know where it is so we don't push deeply into this area. That's a no-no. As you can imagine, we don't want to crack any ribs. It's bad. Okay, so again, talking about the sternum here, you can see the 3 parts broken out into different colors. So this is the manubrium, this is the body, and this is the xiphoid process. Now we do have a jugular notch. If you look at the screen, that's this bit right here. You actually can feel it. It does have a bit of a dent right there, a little dip. That's the jugular notch. I'm not really concerned about the sternal angle or anything like that. Just the 3 parts and the jugular notch. All right, so let's go back a page or 2 and talk about the vertebrae specifically. Let's go back to page 171, I think. Yes, 171. Okay, so at the bottom of this page, it's going to show you the first 2 cervical vertebrae. And before we get into those, I do want you to see how the spine is situated here. This is a lateral view of the vertebral column. So this is the whole thing. And obviously we are right here for the atlas at C1. The vertebrae is situated in 2 curves here. Okay. Now you do have this in your book, but it's not until page 174 where it talks about the different curves of the spine. So if you turn to page 174 in your book, I'll stay right here. So this particular curve is an anterior curve. So it curves forward. And this is called a lordotic curve. An anterior curve is a lordotic curve, okay? Then we go into the thoracic spine and you notice there's a posterior curve. That is called a kyphotic curve. And then again, in the lumbar spine, you have another anterior or lordotic curve. And then in the sacrum, you have another posterior or kyphotic curve. Okay, so our spine isn't straight up and down. It has these lovely curves in it. And the curves, of course, are for a reason. It is to give the spine some stability in anterior and posterior. I'm not going to say movements, but if it was straight up and down, you'd fall over, right? We need a little bit of a snake shape to it so that we have some give, first of all. And second, so that you have balance on one side and the other. It's kind of a little like a spring in that way. Okay. So those are the curves of the spine, and you do need to know those. So if you want to highlight that on page 174, be my guest. Okay, so the atlas. The atlas is the very first vertebrae, number 1, and it is structured very differently than all the other cervical vertebrae, but for good reason. Atlas sits at the top and articulates with the skull. So these right here, these articulation points are called facets. Facet means little face. Perhaps you've heard of the word facet before when talking about gems and how many facets a gem has, like a diamond. What it really means is how many faces. So when a diamond is cut, it's cut into facets so that it reflects light. But what that word really means is face, okay? So these facets are the superior facets. They're the superior articulation points. So the skull will sit directly on those right there. You notice there's a big hole in the middle? Of course there is. This is the vertebral foramen, and this is really for the spinal cord. You have a vertebral foramen all the way down the entire vertebrae because you have the spinal cord pretty much the entire way down the vertebrae as well. Not the whole way, but almost. Okay. Now you have your transverse processes that extend off either side of the vertebrae, and you have your spinous process that extends on the posterior side of the vertebrae. Okay. Now, all the way around, you're going to have the body of the vertebrae, but in C1, it's really small. It's very narrow, as you can see here, pretty narrow. Now, that's not, the cervical vertebrae bodies are small to begin with, but this one's one of the smallest. And really, it's just because of its position at the top of the vertebrae. Sort of its only role is to hold the head. So that's what it does really well. And that's actually why it is called the Atlas. If you remember from your mythology, Atlas was doomed to carry the world on his shoulders. So he actually held the world on his shoulders for his entire life or eternity. And that's really what this vertebrae does. It holds the head on top. Now, two other things that I need to point out here. First of all, these bits right here are called the lamina, and you have them on every vertebrae. So here's C2 lamina, right? That's important because we're going to talk about the lamina's role in some of the dysfunctions. And when you are applying your Swedish and you're going down either side of the spine, you're in the lamina groove. So it's the groove on either side of the spinous processes, but it's called the lamina groove because it sits on top of the lamina of the spine. Okay, and then one last thing, in C1 you have transverse foramen. You don't have those anywhere else. Well, actually you do, but only in the cervical vertebrae. After the cervical vertebrae, they stop. Transverse foramen are little foramen within the transverse processes, and these are specifically for vertebral arteries. Okay, so there's a lamina and the transverse process. Okay, now the axis, or C2, the axis is, again, totally different than any other vertebrae because of this little thing right here. This is called the odontoid process, and odontoid means little tooth. It's also called the dens, so you could refer to it as the odontoid process or the dens, both are correct. C2 also has the vertebral foramen, of course, that all the vertebrae do. Here's superior facets. Now, these superior facets are going to articulate with C1 because C1 sits on C2. You also have transverse foramen in the transverse processes here. Okay, you have lamina, right? And you have a nice large spinous process here. One of the things I do want you to note is this little bit right here. Can you see that? Yeah, there's a little notch in the spinous process. I know I've mentioned this before. The notch in the spinous process is to hold the nuchal ligament. Remember ligamentum nuchae? The ligamentum nuchae sits directly in these notches, and they are along the posterior cervical vertebrae only. Once you get to the transverse vertebrae, or thoracic vertebrae, they stop because it's only there to hold the nuchal ligament, okay? Now, this odontoid process, or dens, fits right here. See that? So C1 will sit over top C2 like this, okay? And it's called the axis because C1 is going to be able to rotate on C2, right on that dens. So you can do movements like this, okay? It's lovely. So the axis allows you to do this. The atlas allows you to do this. So you can rock the skull on top of these superior facets. Okay. So just some interesting landmarks on the atlas and the axis that make them unique. And again, different from all the other vertebrae. So a typical cervical vertebrae looks like this. Okay, fine. We still have our vertebral foramen. We have our lamina. We have a nice big lamina groove now. See that? Lovely. We have our transverse foramen here. See, here and here. We have our facets. Of course, you're always going to have superior facets and inferior facets in the vertebrae because you have a vertebrae above and a vertebrae below. And of course, they have to articulate. Here, though, we have the body of the vertebrae. So now we're starting to see larger bodies in the rest of the cervical vertebrae, and they're going to get even larger as we work our way down the spine. Okay, nice long spinous process, and this one is also forked or bifurcated, but you can't really see it on this picture. So the rest of the cervical vertebrae look like this. Okay. If we move into the thoracic vertebrae, you notice that looks even more wonky. Okay. We still have the large body of the vertebrae. We have the vertebral foramen right here. Yep. The facets, though, are moved a little more posterior, and instead of sitting like this, they're actually going to start to sit like this. They're going to fit together face to face like this, instead of like this in the cervical vertebrae. And this is because on this anterior surface right here, anterior to the transverse process, you're going to have ribs. So the ribs have to articulate here. So you can't have a facet there. You have to have them, set back a little bit. Okay. So we have these nice long transverse processes here. And then you can see on this part, anterior to the transverse processes are the costal facets. Costal meaning ribs. So this is where the ribs are going to attach. Okay. Sort of more on the body or closer to the body of the vertebrae. Nice long spinous process, lovely lamina groove. No bifurcation on the spinous process at all because we don't have the ligamentum nuchae extending into the thoracic vertebrae. It just doesn't. And there are 12 of those, and they get a little bigger as we go towards the lumbar vertebrae, which you can see right here, even larger bodies, right? Huge, because we're holding the whole weight of the upper body on the lumbar spine. So these suckers have to be big. They have to be hardy. See how big and wide they are. The vertebral foramen gets a little smaller here because we essentially run out of spinal cord right about here. We still have nerves. It's just not considered spinal cord. If that makes sense. We still have all the same structures, transverse processes. We have the spinous process. Of course, we have the superior and inferior facets that are going to sit like this, same as in the thoracic vertebrae. These really are for stability. We've got big, thick discs on top of these lumbar vertebrae, and really these are weight bearing. That's what they do, okay? Now, one last thing that I want to show you, because we're going to be doing this in class. When we begin our palpation of the spine and the back, we don't really talk about where these landmarks are located in terms of level of the spine. So what I mean by that, C7 is right at the base of the neck. I said when you bend your head forward, the spinous process that sticks straight out, that's C7. So you should know this one, right? We've talked about that one in class. C2 or C2, T2 T2 lines up with the superior angle of the scapula, ideally. If your shoulders are elevated, then it's not going to, but ideally, in a perfect body, T2 would line up with the superior angle of the scapula. So you have an idea of where T2 would be. T7 is going to line up with the inferior angles of the scapula, roughly. Again, in a perfect body, they would. Not every body is situated like this, okay? And of course, if you are imbalanced muscularly and one shoulder is elevated or one shoulder is depressed or something like that, that's going to throw this off. T12 is around the 12th rib here. And this is the narrowest part of you. So this is your natural waist, okay? And your natural waist is also just above the iliac crest here. This is incorrect. I don't even know how to explain what they did here, because there is not nearly this much space between T12 and the iliac crest. There is not. It looks like there's, oh yeah, there's a ton of space there. No, 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 and no. There's maybe 2 fingers width at most between T12 and the top of the iliac crest. And it's not because of the lumbar vertebrae in here. Remember, the lumbar vertebrae curve anteriorly. They're not straight up and down like this. So you do not have this much room between here. That's all I'm going to say about that. So T12 and L1 are really close together, and they're basically where your natural waist is, the narrowest part of you. And then L4 lines up with the top of the iliac crest. Okay. So if you're palpating the spine, you can actually feel the spinous processes and probably just count down and find them anyway. But those are the visual landmarks for you to find different pieces of the spine, okay? And this, again, is what I was talking about earlier, the lordotic curve, kyphotic curve, lordotic curve, kyphotic curve, okay? Now, of course, this develops over time. When you're born, it doesn't look like that. As you grow, your spine grows into this position, okay, with these lovely curves. And they should be like this, but over time, you know, as we age, sometimes they break down a little bit. Sometimes you get an excessive thoracic curve. You see, you know, people hunched over like this and they have that big hunchback kind of thing going on. That's called kyphosis. Sometimes your cervical lordosis actually straightens out instead of keeping the curve over time, and that can lead to degeneration of the invertebral discs. You know, sometimes you get an excessive lumbar lordosis. So, you know, lots of things can happen to the spine over time. Sometimes it's just genetic, you're born that way. But that was introducing you to some of the disorders that we'll be talking about later when we discuss spinal disorders specifically, rather than disorders of the muscles necessarily in that area, okay? Because most of the things that occur are going to occur to the spine, which is then going to affect the muscles instead of vice versa. Okay. All right. So that's it for bones of the spine and thorax. Have a nice day.